Okay, guys, guess what? We're gonna do a workshop on ice massage and cold therapy for stiff, painful muscles and joints. So this is a physical therapy workshop because a lot of people have no idea what to do when you sprain or strain joint, ligament, tendon, anything in your body. What do you do first? And what you do first, remember, is going to make a difference in how fast that injury will repair itself. Inflammation, remember, is not good. Oh yeah, we forgot. Hodo's here. So, hey, you want a cookie? You want that? Here, we'll put that right there. Okay, he's going to keep an eye on me. So, do you know how to use an ice pack? Do you know how to use, well, have you ever even heard of ice therapy? Okay, using ice massage. So I'm going to show you in this workshop lots of different things that have to do with treating joints that are not only acute, and acute means that the injury was within, anyways, from 3 to 4 days old maximum. So that's acute. So you're going to treat that injury completely different than if you had, let's say, called a chronic injury, which means you've had it for, well, more than usually a week, and now it's chronic. Remember, it's not going away. Acute means usually about 3 days. It's usually down to the ground and going right back to normal. But if there's an underlying problem, there's different types of therapies that you're going to go ahead and do. So we're going to go over not only different types of cold therapy, we're going to also go over what's called hydroculator therapy, which is moist heat therapy, because that's what we're going to use in conjunction with chronic injuries. So a lot of the information I'm going to go over is going to be on part 2. That has to do with therapies, protocols, times, how to do certain types of techniques like ice massage, the most effective technique I know for reducing swelling. Okay, remember, and there's a lot of different ways to be able to do physical therapy. And I was told several times over the years to be responsible and not talk about this to the public world about physical therapy. A lot of physical therapy organizations, just people in general that have anything to do with this type of care, the last thing, anybody of that profession wants you to do is maybe learn how to do things yourself so you don't have to get therapy, because that's a big business. So the more you can learn how to do things on your own, remember, these are called life skills. And physical therapy, do you know how to take care of yourself? And we've talked about detoxification. When's the last time you've done any detoxification at all? We've talked about how to detox, right? Remember, sauna protocols. Have you tried any of those at all? Have you cleaned your skin with vodka, mineralized solution? So just a quick story here. When I went back to California, I was there for about a month, and about every 3 days, I just felt dirty there. And wow, was I. I cleaned my skin with the alcohol mineralized scrub with a white towel, and my towel was filthy because there's so many dust particles, so many aerosols being sprayed, just so many particles of stuff that stick to your skin. Without even me going in, getting dirty, my skin looked like I was rolling around in the dirt. And this is hidden in your pores. Okay, so anyways, let's get back to, because there's lots of different protocols, and this is just one of the areas that you can put into your tool chest at home. So we'll go over also some different products that everybody should keep in their tool chest, okay, as far as anytime you have any type of injury, cut, bruise, contusion, anything like this, you can learn how to treat these things yourself before they fester or before they start to become chronic. Because when they become chronic, when you get a chronic injury, that means that now you have scar tissue growth. Okay, and you want to get the inflammation out as fast as you can, is because inflammation will tighten up all the joints, ligaments, tendons. It's going to make all the fluid in that area so it's not movable. So you're going to wind up getting what's called scar tissue, just a lot of stiff joints. And even if it heals, and if you don't do the therapies correctly, because remember, Just because the joint healed doesn't mean, or the ligament healed, doesn't mean that it's healed, because now it did heal, but it healed tight. Remember, and when you get an injury to any of your muscles, ligaments, tendons, any of these joints, okay, they must be rehabilitated, because if not, a lot of times you get scar tissue that's in a joint, and now all of a sudden, yeah, it doesn't hurt anymore, but if you hurt it again, now it's going to rip. Is because all the tissue inside went ahead and hardened up, because the inflammation was there for too long. So anyways, one of the things that I want to point across here is you want to get away from as much inflammation as you can, as fast as you can. And you'll notice when you do these therapies, if you do have pain, stiffness, I mean, just a lot of different types of, a lot of people have a lot of different problems, especially with hurting yourself, banging your knee in the table, things swells up. You were running maybe, and all of a sudden you got low back problems, knee problems, wrist problems. I'm going to show you also on part 2 how you can use ice therapy for taking swelling out of your face. A lot of people have these baggy eyes. Remember, you have inflammation in your face, and you can decrease a lot of inflammation by fasting. Okay, and if you've got baggy eyes, remember, if you've got puffy little suitcases underneath your eyes there, and I see that in a lot of people, a lot, especially a lot of politicians for some reason, okay? But remember, you've got flow problems. Okay, so let's get into ice massage and cold therapy for stiff, painful muscles and joints. I did spend a lot of time so you could learn. Remember, part of your job is not just to watch me do things here, but read the description that I wrote here so you can learn about some of the things here in more depth. Because I do spend a lot of time here putting these descriptions together. I just write them myself, and we have one other person that runs all website, everything, programming, editing. His name's Jess. So it's just a two-man band here. So it takes a lot to put these out. So if I do put in a lot of time to do these, it would be good if you want to learn and really learn stuff, try to read what we put down. So let's get into the types of ice packs, just real quick here. Just go over this part, because there's lots of little pieces here, and I'm going to try to keep this as fast as we can. And again, part 2, we're going to go over all the protocols, practices, and principles that I know. Remember, let me just give you a little background here first. I became a Doctor of Chiropractic in 1984. I was the youngest graduate ever, 23 years old to get out of school there. Okay, did I have a mission? I was on a mission. Remember, I was into health, I was into bodybuilding. I look like I'm 63 years old, and I still have stomach muscles, 63 years old. Okay, so I'm into health. I'm into all these things that can keep me healthy. So anyways, once I graduated chiropractic college, okay, remember, you're a primary care physician. You learn specializations of physical therapy. Okay, you learn lots of other licenses also. I was also a radiologist, okay, to be able to not only take x-rays as an x-ray technician, okay, because a medical doctor has to go ahead and hire an x-ray technician because they don't have a license to take x-rays. They don't even have a license to read x-rays. They have to send it to a radiologist. So when we graduate, and we can take extra courses like I did in physical therapy and also radiology, so we could go ahead and do our own thing under one roof. My brother and I put together the American Chiropractic Medical Group. Was the largest group of all different types of doctors, acupuncturists. We had orthopedics. I had internist medicine. We had a blood lab. We had probably about 7, 8 different chiropractic practitioners. We had a big physical therapy room that could take up to like 25 patients at a time. Okay, with all the best of the best of the best equipment for physical therapy. So what I'm going to do is I'm going to go over a lot of different things that, like I said, I would be respectful, and I'm only going to show this on our private channel, is because, like I said, I don't want to tick off a lot of people, because your profession, of course, is your profession, and the last thing you want me to do is show me any of your profession that anybody can do on their own. Okay, physical therapies, it's not that it's easy, it's just learning what to do, okay, and getting some practice with it. And if you have a family, guys, well, guess what? You've got animals, guess what? You can learn a lot of different things to be able to give yourself some sufficient life skills. You tell them, Hodo. Okay, so, you know, we saw about 500 to 600 patients a week, 6 days a week in our office. Remember, we had 20 different healthcare professionals, okay, assistants, physical therapists, everything in the office there. I saw between 35 and 50 patients a day, the same as with my brother. Okay, we were sort of like the powerhouse of the place there. And a lot of the other doctors saw between 10 and 20 people a day. And that adds up to a lot of people every week going through the office. And almost everybody went to physical therapy, okay? Because people come in to see us is because they have an acute or chronic injury, neuromusculoskeletal problem, specializing in that area. So we got a chance to be able to try all the different therapies. Remember, we had the top of the line, state of the art P-wave electrical systems. That's to take away different types of inflammation. We had Russian stim. These are all electrical machines. The Dynawave machines. Okay, we had all different types of traction machine, lumbar traction machines, spinal traction, cervical traction machines. Hydroculators, I mean, all different types of cold massage, but a lot of different types of advanced types of therapy, of ultrasound, of course, just all the best of the best of the best stuff that you could buy, we had. So I got a chance to find out what really works and what doesn't. And the number one thing that you could do at home right now is ice therapy on your injury, so you don't have to go to the doctor because you didn't take care of it in the beginning. The faster you could take care of any type of sprain, strain, okay, the faster it will heal. If not, you're going to go ahead and wind up probably going to some therapist because it's not healing correctly. So anyways, I got a lot of background experience, okay, real experience, not just hearsay, on what works to be able to really be effective in your home therapy program. So we'll go ahead and do different types of videos on eartheracademy.com. $10 a month. That's where I show all the private protocols, practices, and principles. Everything that I like to share is way too sensitive for social media. So I don't need any of that. So anyways, lots to learn over there. And let's get into this again. You can use anything for an ice pack. I'm just going to go over the different ways. This is things, you know, this is a ice pack. It's just hard block of ice, right? Okay, and these work fine, okay, to be able to use. Remember, this is an emergency. You can use anything to be able to take out inflammation. Let's say you twisted your ankle. As soon as you twisted it, bam, the thing swelled up right away. You can't even barely walk on it. What are you going to do? Do you know what to do? Just think. Okay, you may think you do, and even if you put ice on it, are you putting it on with too long a time period? Not enough, you know, there's time durations that are optimal to be able to take down swelling. And it's not just putting it on once, but you must rest it in between. We'll go over, like I said, all the protocols that I know that work very good. So you've got a very hard ice pack. These are the ice packs I like. I'm going to give you a bunch of links on Amazon and stuff where I got all these ones from here. This is the one I keep in my freezer. And anytime I get any type of injury, this is a flexible ice pack. And flexible ice packs are the best ones. They come 2 to a pack. This thing's stuck in here. They come 2 to a pack, and they have a gel inside, and the gel doesn't get hard. So it's flexible versus this thing's not going to bend around your arm too good versus this here, okay, is going to go ahead and bend because I can bend it around. But like I said, I'm going to show you different therapies to be able to, and you always want, anytime you use ice, therapy or anything, okay, look, this is a piece of plastic. First of all, you'd want to wipe this thing clean, because if this water gets on here and the water gets on your skin and you keep the ice on there, you could burn your skin really easy. So there are some precautions and different things to do. So you wipe off, you know, the plastic, okay, because remember, it's got little frost on the outside and that's going to melt. So wipe that off, and then you want a super thin piece of material that goes between the plastic and you. Just super thin though. Like thinner than even and this is really thin cotton. Let me just show this. You can see this in the camera there. Watch out, Hodo. And this is really thin right there. Okay, so when I put the ice on without a t-shirt or anything, it just goes directly on my skin. And it's going to go now the deepest, because you want the ice to go as deep as you can, because if not, it's not going to go ahead and work. So these are really good. They're like $20 for 2 of them delivered. So what a deal. So that's flexible ice pack. Okay, look, you can make your own ice pack in an emergency, right? Just take a bunch of ice, put it in a towel if you want, beat it with a mallet, okay, with anything to be able to break it down into smaller pieces. Get yourself some peas, corn, any vegetables. These are organic blueberries, let's say, and you can see they're all separate in there. And I could wrap this around using this as an ice pack. But then again, what do? You don't put the plastic on directly on the skin. You wipe off the water first and put one thin piece of material between you and the ice. Okay, so that's another one there. Hey, you know what works really good too? Look, here's a big porterhouse steak. Same thing. Okay, these work excellent for people with for your thorax or your spine or whatever it is. Okay, then these are all vacuum sealed, of course, so it's not going to hurt anything. You can see this is a package of liver. You can use anything you want to be able to make an ice pack, but the best ice pack, like I said, so go ahead, part of your home tools that you need for any type of, you need medicine supplies. Okay. I'm going to go over also another video. I'm going to show you people how to go ahead and, if you had to go ahead and, let's say you got cut, do you know how to stitch that up? Okay, we'll show you what I learned. Okay, I went to lots of different workshops on how to, after you graduate from school, your learning never stops. Okay, just because I'm a doctor of chiropractic, remember, I want to learn everything, okay, that has to do with healing the body and healing the body that I can do myself. I've numerous times went ahead and stitched people's skin up for them, friends, right? Myself and my knee, my arm, my leg. I've done it many times. I just do it myself. So that's another good video on how to learn how to stitch yourself. But you need definitely supplies, and the best, like I said, simple supply is in advance. You're already going to know that you're going to use your ice pack. So let's say your hip hurts, right? What do? I put this thing like this, and I just put it inside my waist, and I just bend the pack around my hip like this, and I can walk around the house and keep this thing on for a good 30 minutes, whatever it is. Okay, so remember, ice is easy to do, but you have to learn anytime that you have back stiffness, back pain. Icing is one of the best ways to decrease the amount of stiffness, especially when you stretch afterwards, and we'll go through that on part 2. Okay, but one of the best things is anytime, remember, you have stiffness or pain is because you have inflammation. And if you can get the inflammation out, okay, and the most effective, as we'll go through, is ice massage. Okay, in this cup, I've frozen some water. Some of it's leaking already. Yeah, I know. It's already melting. Okay, I'm going to show you the most effective treatment, but doing it correctly is one thing, and learning how to do it. Remember, this is ice massage. So when you use an ice pack, that's called static. Okay, that means you're just going to put it on there and it's going to sit there and you're going to do nothing. But when we do ice massage, remember, we're not static anymore. I'm moving that thing around and I'm pushing the fluids around. Way more advanced, and that's the most effective therapy out of all the ice you can do. But learning the ice therapy, remember, in time, you'll use it on yourself, you use it on your children, you use it on your neighbor. Okay, because it's miraculous. Like I said, you can use it on your face and you can take down a lot of the swelling. Okay, a lot of models do this. A lot of people that have little micro wrinkles. Okay, you can use different types of remember, in your tool chest at home. Okay, let me just go over a couple of things. These are some of the things that I have in my tool chest. They sit right on my counter in my bathroom. And I'll put all the links down there. Okay, these are good things to use because I use them on cuts, burns, scrapes, for skin regeneration, in my coconut oil, a lot of different things. Okay, I make a lot of different products with these different things that you'd want to have in your little tool chest, your medicine chest at home. So this is Georgia pine gum spirits. This is turpentine, but this is pharmaceutical grade. It's distilled pine oil. I have pharmaceutical grade. This is DMSO, 99.99%. Okay, we'll show you the one I use because I like to get the ones that don't stink. Okay, because you're going to use this, and this works excellent. Okay, you just have to know what to use it for and why. I also have a magnesium chloride, magnesium minerals with trace minerals. I use that on many things. Okay, this is a concentrated fulvic acid, and you've seen lots of videos on how I accelerated my healing by using certain types of things on my wounds so I could make it heal faster, so it doesn't fester with different types of infections. Okay, this is a 20, and I also have a 30% Lugol's iodine, right, Hodo? And I have 3% and 12% hydrogen peroxide. Okay, so, oh, you want one of these? I got a peanut for you. You want one? Oh, there you go. He likes these. These are Baracus peanuts. Milan gave me a bag there of these, and a friend of mine. And Hody loves them. Me too. Okay, so let's just go over this little part here too, okay? Because you need to understand. Let's say you're an older person, okay? When you're under like 20 years old, most likely you don't have any real high levels of scar tissue in your system or arthritis or any type of hardening of the tissues, okay, that come with old injuries. So when you're 30 plus years old, you start having different types of problems in the joint and in the muscles. And when you bruise these, okay, these tissues, these oxalate type tissues that are in your joints, they're in your muscles, when you bruise them, they cut a lot of the tissue there. So this is why you get a lot of bruising and a lot of contusing, okay? So let me just show you what that looks like, a close-up. So think of this big piece of coral right here as this is an osteoarthritic spur. And let's say you banged this thing, okay? And since you banged it, you chipped off a little piece, okay? And this is hooked onto the bone. So you want to get the inflammation down as quick as you can, because remember, once you hurt these osteophytes, they just grow bigger and bigger and bigger. These, you can call them parasites, right? Okay, these are combinations of oxalic acid and calcium and different types of minerals that make up this like coral-like structure. You've seen crystals, okay? Crystals can go ahead and form in the tissues. They can form in the ligaments. They can form in anywhere in the body, okay? And these are other things. When you sprain and strain yourself like this, the last thing you want is these crystals to form back. So doing therapies is very important. And not only doing therapies, but rubbing on certain types of things on top of the contusion to make sure, like the DMSO, like I said, we'll go over this on part 2, to make sure that the areas stay soft and don't heal with scar tissue. So let's start part 2. This is a 33, good symbolism there. There's 33 pages long. And I go over different types of, oh, this is what I wanted to show you too. So this is the hydroculator pads, because we're going to also show, you know, how to use these. These are pieces of knitted canvas with clay inside there, and we heat those up to about 160 degrees. And then we put, this is for the neck, and this is for the spine, and we open up this towel and we put these inside, and this gives us moist heat. So, you know, a lot of people, let's just go over this part real quick here, because a lot of people, in the description I mentioned this, okay? A lot of people want to use a electric heating pad. Almost everybody I know, oh, I put heat on it, because someone told you to put heat on your stiff muscles. And you're using heat, which is good, but it's dry heat. And dry heat, I know as a therapist, okay, all that does is increase the amount of spasm. It relaxes it at first, and all of a sudden now it dehydrates the cells. You need to use moist heat. That's why I'm going to show you how to use hydroculators too. That'll be also another video, but we'll get into on part 2. Because with the chronic injuries, remember, we're going to go ahead and use cycles of cold and hot and cold and hot. And doing these things correctly, okay, makes it so we could pump out the chronic fluid, the chronic, you can call it thick oil that's surrounding the joint, and all that acidic waste in there, all that inflammation, remember, needs to get moved out. If not, it forms all of this stuff. So a lot of people 20, 30, 40 years later, guys, if you're 40 and 50 and 60 years old, you know as well as I do. Look, I'm 63 here. You know as well as I do, okay, that your joints are getting stiffer. And ice is your friend. It's free. Just have to learn how to use it and be disciplined to be able to use it consistently when you have stiffness. And again, you don't just use the ice. You have to do some therapy behind it, like self-massage. Okay, let's say my back's hurting, whatever it is, I do cold on it. I can do all different types of self-massage, rolling on the roller pins, right, for your spine. We've done videos on that. Exercise, stretching. Okay, you can do a lot of different things. Like I said, I'll go over in part 2 a lot of different stretching things. Once you put ice on something, you do, especially if it's chronic, you do want to massage it out. You're trying to push the fluid out. This is why we're going to show you ice massage, because you can do that all at once, the most effective therapy that you can do. So read the description. We'll go start part 2 right now, and we'll get into therapy. Get, like the question to ask, what would you do with an acute injury? That means it just happened right now within the first 3 days. And what would you do within a chronic injury that you've had for a couple weeks to a couple of years? Okay? And you want to feel like what the therapy is doing is going to make you feel better. And that means you'll do it more. Because if you do therapy a couple of times and it doesn't work because you didn't do it right, what happens? You don't do it anymore because it doesn't help. And a lot of people go to the therapist, guys. You got to learn therapy yourselves. Okay, going to the physical therapist, that's one thing. They do a lot of minimal stuff, that's why we specialized in our clinic. Okay, I used a lot of different electrical modalities and different things, ionophoresis, pushing certain types of compounds into the muscles to give the muscles relaxation. Okay, we used all different types of deep massage with the elbows and everything. I had full-time physical therapists, massage therapists, and of course, remember, as a Doctor of Chiropractic, I am the physical therapist. I can hire anybody below me to help me in my office. Okay? So when you're a medical doctor, you have to hire a physical therapy, because when you went to school, you didn't learn anything about physical therapy. You didn't learn anything about, how to take x-rays. It's because you're not an x-ray technician, but you did learn a lot about using petrochemical pharmaceuticals. Okay? So you can see the difference. Okay, so learn these therapies yourselves, guys, because, if you go to the doctor, shame on the doctor if they're not showing you, or the therapist. You're paying the physical therapist, look, you're going to learn so you could do a lot of this stuff on your own if need be. But then again, this is why I like Earther Academy, because you can do a lot of things. Remember, it's all an experiment. Everybody's different. If you've got a lot of body fat, then ice massage, you're going to have to go ahead and, if you've got a joint problem and you've got to get through a thick fat pad versus someone real thin and in shape and has a very thin skin, the ice and the cold is going to affect them a lot deeper than the person that's got a fat pad that big. Okay, so there's different techniques, to be able to make sure that you really, really freeze down the joint. Right, Hodo? Here, give me a kiss. Give me a kiss. He loves his daddy. Okay, let's start part 2. And like I said, don't use electric heating pads. And I do show you in the description, if you are going to use an electric heating pad, let me show you how you could make a moist heating pad out of it. I don't recommend it, but this is what I used to do, and I used to show patients because they didn't want to go ahead and buy the hydroculators. They're cheap anyways. These are like 20 bucks for the towel. And you can see when you put the pad in there like this thing would wrap around your neck, and this blows in moist heat into the tissues, right? So let me just look here before we sign off. I think we're good. So let's get into the therapy part of this. Read the description, and I will see you on part 2. What do you think, Hodo? You want another peanut? There you go. Oh, I took another one. All right, guys, we'll see you in part 2. Aloha, and the sheep are baaing at me. Bah! All right, we'll see you guys.